Imagine that you've just walked out of a doctor's appointment. The news wasn't great. You're accompanying a loved one. A diagnosis of cancer in the head and neck region. The doctor outlined the survival rate and the expected severe side effects. There's a tough road ahead. At the next appointment, the doctor informs you that you've been prescribed radiotherapy and that the treatment will be delivered over a 6-week period daily like this. The machine on the left delivers the radiation while the patient lies on the treatment couch. Clearly, cancer is our main target, but at the next appointment, you're surprised to learn that because it's very difficult for us to position that patient the same every day with sub-millimeter accuracy, and because during that 6-week period, a patient loses weight which can change their internal anatomy, we actually put a margin around that cancer, and that whole margin receives a radiation dose. And that's to ensure that we don't miss the cancer. However, the problem with giving more dose means that we give radiation dose to healthy tissues, such as our salivary glands. And at the end of treatment, this leads to oral difficulties with swallowing, speaking, oral pain, and extreme dryness of the mouth, which is a huge impact to a patient's quality of life at the end of treatment. So that tough road just got even bumpier. My research is looking if we can reduce safely the margin in radiotherapy. As demonstrated by this peeled orange, even reducing the margin by a small amount leads to a large reduction in the total volume of tissue that receives radiation. My research is developing a tool, a software tool, that enabled us to detect if we're at risk of underdosing a cancer or overdosing healthy tissues. The first part of my research built some statistical modeling to tell us if we had a persistent change in a patient's anatomy during treatment, or was that change just due to random day-to-day variation. The second part of my research, I extended some image processing techniques to enable us to track how much radiation dose was delivered to 1 cubic millimeter of tissue to a patient. In a retrospective analysis where we simulated 12 patients receiving different size margins, we were able to really increase our knowledge of factors which may put a patient at risk of cancer underdosage. We also found a reduction in radiation dose to healthy tissues for all patients when we use this reduced margin. But most importantly, we're able to accurately monitor a patient's radiation during treatment. So if they are at risk of a cancer underdosage or at risk of a healthy tissue overdosage, we're able to flag their treatment and make a change during their treatment. And that's my software tool for breaking the wall of radiotherapy toxicity.